When I completed my presidency of the American Academy of Pediatrics, I became seriously involved with the AMA, and today I chair the Council on Legislation and serve on the Governing Council of the SSS. I am in active, independent rural practice where I take care of patients and help physician practices remain open and solvent. I have extensive successful experience in government advocacy at the state and federal levels, putting policies into action for patients, families, and physicians. If elected to the board, I will use my advocacy experience to put HOD policies into action. I am passionate about the practice of medicine and continuing my 24/7 commitment to the mission of the AMA. I will never burn out. I am Dave Tayloe, and I ask for your vote for AMA trustee.
How is your typical professional day divided? Not during this pandemic, but before and after. What % is spent in direct patient care, research/teaching, administrative, or other modes? What will this practice experience bring to our BOT?
I spend 2 days a week in patient care, and my other days I spend in community-based coalition advocacy, state government advocacy, and worked with the North Carolina Pediatric Society, the North Carolina Medical Society, the American Academy of Pediatrics, and the American Medical Association. My vast experience in advocacy will be my main asset as a member of the Board of Trustees. Plus, I have established a rural independent private practice solo and built that practice into a complex medical home that includes 4 offices and 7 school-based clinics coordinated by an EMR. And I continue to be quite involved with the running of that practice. So I bring a practice background, successful advocacy background, tremendous involvement in organized medicine to the board.
What specific ideas do you have to improve and retain our membership?
I think my perspective on that is of a pediatrician who got a lot of negative vibes about the American Medical Association from pediatricians who thought the AMA was just an organization that looks after Medicare for doctors who take care of Medicare patients. That is totally untrue. I've been very pleased with the amount of advocacy the AMA does, and especially they've endorsed just about every American Academy of Pediatrics policy I can imagine. So I think the biggest thing we have to do is reach out to the people we know in medicine, explain to them the value of the AMA. I just couldn't imagine the American Academy of Pediatrics being really successful with advocacy without the help of the AMA. And certainly my years on the Council on Legislation have taught me how amazing the staff is at the AMA that can help us accomplish big things in the government arena.
What are your thoughts regarding healthcare reform? Specifically comment on single payer and a public option.
I think healthcare reform needs to include the private sector as well as the public sector. I have worked for most of my career for about 70% of the Medicare rate, so I'm not sure government is going to reward physicians fairly to incentivize bright students to go into medicine. So I'm all for a private-public combination. We have had good luck with that with the CHIP program in North Carolina, which started out as Blue Cross, and they provided Medicaid benefits and allowed us to amend the program to make it work for patients, families, and physicians. So I would not be in favor of a public option or single payer based on my experience with Medicaid and my knowledge of Medicaid after 8 years on the Council on Legislation. I think it's got to be a private public hybrid system similar to what we have.